ever been in the hospital, chances are there's a critical safety procedure going on that you probably didn't even notice. It's designed to prevent a really silent but serious danger. So today, we're going to pull back that curtain and decode how hospitals work to prevent dangerous blood clots. So let me ask you, what do you think is one of the most common yet preventable dangers for someone in the hospital? It's probably not where you're thinking. The answer is blood clots, a huge and often totally invisible patient safety risk. All right, let's start by really understanding this silent threat. The risk actually starts with something super simple. When you're in the hospital, you just don't move around as much. And that right there, that inactivity, is where the danger can begin. Okay, so the big fancy medical term for this is venous thromboembolism, or VTE for short. The easiest way to think about VTE is as the main umbrella term. It just means a blood clot is blocking a blood vessel. And under that umbrella, there are two specific types you've probably heard of. First up, you've got deep vein thrombosis, or DVT. This is when a clot forms in one of those big, deep veins, usually in your leg. Picture it like a sudden traffic jam on a major highway, inside your body. It just slows everything down. But then there's the really scary one, a pulmonary embolism, or PE. This is what happens if a little piece of that DVT clot breaks off, travels all the way through your bloodstream, and then gets stuck in your lungs. This is a huge medical emergency because it's blocking blood flow right where you need it most. Okay, so that's pretty serious stuff, right? So how do hospitals even begin to protect their patients from this? Well, they follow a really clear, structured blueprint. Look right at their policy. Their mission is just so clear. It's not about waiting around for a problem to happen. No, it's about figuring out who is at risk ahead of time, picking the right prevention method, and stopping clots before they can ever cause harm. It's all about being proactive. So that's the goal. But how does it actually play out on the ground? How does the medical team figure out your personal risk level? Let's break down that whole assessment process. Well, the policy is super specific about who gets screened. Pretty much, if you're an adult who gets admitted to the hospital, it doesn't matter if it's for surgery, a medical issue, cancer treatment, even long-term rehab, you are going to be assessed. They cast a really wide net. The only people it generally doesn't cover are kids, outpatients, or folks who are just in and out of the ER without actually being admitted. And this is really important. It's not a one-and-done kind of thing. Your risk isn't just checked once and then forgotten about. It's a continuous process. You get assessed right when you're admitted, for sure, but they also reassess you anytime your condition changes. Say you move to the ICU, or after any kind of surgery. Now, they pay extra special attention to maternity patients because they have their own unique set of risk factors. For them, the assessment starts way before delivery. I'm talking the very first pregnancy booking visit. It gets checked again if they have to be hospitalized during the pregnancy, and then one more time after delivery, with things like your BMI being watched really closely. All right, so the team has figured out your risk level. What happens next? What do they actually do to prevent these clots from forming? Well, they have two main strategies they use, which is known in the medical world as prophylaxis. It really boils down to two main game plans, mechanical methods and pharmacological methods. Mechanical is just what it sounds like, using physical devices to help your blood circulate better. Pharmacological, on the other hand, uses medications. You might know them as anticoagulants or blood thinners to stop clots from even starting. Let's start with a mechanical tool you've probably seen, maybe even worn, anti-embolism stockings. You know, those really tight-fitting stockings? They apply a gentle, graduated pressure to your legs, which helps squeeze the veins and keep the blood moving along, making it a lot harder for clots to form. Then you've got the next level up in mechanical prevention, these IPC devices. These are basically inflatable sleeves that wrap around your legs. They're hooked up to a little machine that automatically inflates them, gives your legs a squeeze, and then deflates them, over and over. It's like an automatic massage to push blood back up towards your heart. Now, switching over to the medication side of things, one of the most common tools in the toolbox is something called low molecular weight heparin, or LMWH. This is a type of blood thinner, usually given as a small injection that gets in there and messes with the whole clot-forming process in your blood, making you way less likely to develop a DVT. So, the hospital has this whole system in place. But here's the thing. You're not just along for the ride. You actually have a really crucial role to play in your own safety. So, what can you do? The biggest thing you can do is be an active part of your own care team.
Don't ever be afraid to ask for information about your personal risk. You need to know the warning signs, like leg pain and swelling for a DVT, or sudden chest pain and shortness of breath for a PE. And as much as you possibly can, move around and drink water. Seriously, even small movements can make a world of difference.
So, after all of this, what's the one big takeaway? It really comes down to one single powerful question. If you or someone you love is ever in the hospital, remember to ask this. Asking, what is my personal risk for blood clots and what is our plan to prevent them, shows you're informed, you're engaged, and you're a true partner in your own care. It might just be one of the most important things you do during your entire stay.